Hi, I'm David Kerr, Professor of Cancer Medicine at the University of Oxford. I have an abiding lifelong interest in the biology treatment of colorectal cancer, as many of you know. I'd like to talk a little today about colorectal cancer in younger people. I hope I don't cough and sputter too much. As usual, I've got some sort of a miserable cold that I got from the tiny children, so apologies for that in advance. No, I'd like to talk about colorectal cancer in young people. We have a lad of 14 that we're giving adjuvant chemotherapy to just now, who presented with T4N2 disease. Difficult disease. We've done some additional prognostic tests on the tumour using our digital pathology algorithm, showing, not surprisingly, it's in an aggressive and poor prognostic group. So we're going to give him 6 months of treatment with capecitabine and oxaliplatin. But it did make me think again a little about the, in some ways, remarkable increase in incidence that we're seeing in young adults. By that I mean individuals who are less than 50. If we look, for example, at the United States, since the early 1990s, the incidence rate of colorectal cancer in young adults, those under 50, has doubled. It's projected by the year 2030, current age population pyramids, 15% of all new cases of colorectal cancer will be in young adults. And while we're seeing a significant decrease in incidence in older people, we're seeing a completely opposite trend in younger people. Similarly so with mortality. If we look at mortality in older colorectal cancer patients, it's improving, but remaining stagnant in those who are 50 or under. It's a genuinely puzzling phenomenon. It's one which is being intensely investigated, not surprisingly just now. And in terms of some of the ideas that people have explored, it won't surprise you, around lifestyle, diet, the other contributing factors, physical inactivity and so on. Is there anything that is associated with the other risk factors that are genetic? There doesn't seem to be a particular number of particularly increased incidence of predisposing conditions such as family history of colorectal cancer, polyps, or any of the hereditary symptoms that we might expect. What is interesting, though, is that there is a birth cohort effect. What that means is that when we look at the incidences across the different decades, again, using data from the United States, if I may, the incidence rates are higher in 40-year-old persons born in 1970. They are between 24 and 25 per 100,000 of the population, compared to a 40-year-old person born in 1950. Its incidence was only 18 per 100,000 of the population. This pattern becomes even more pronounced in younger generations, including Gen X persons born between 65 and 1980, and millennials born between 81 and 1996. So increasing rates across the generations have been noted not only in the United States, but across Europe, Canada, Australia, and Asia. And this birth cohort effect, I think clearly demonstrated, suggests that exposures to or factors in early life, such as infancy, childhood, adolescence, could be important determinants of developing colorectal cancer as one grows that bit older. And to that extent, there was a recent, recent interesting a trial reported at ASCO. One of the areas of interest is the gut microbiome. Some of the hydrogen sulfide producing bacteria, like Fusobacterium nucleatum, these are minor bacterial populations in normal people, but they are significantly overrepresented in people with colorectal cancer. And these are bacteria which, through production of hydrogen sulfide, are pro-inflammatory, pro-carcinogenic. So, if you like, these could have a role to play in the genesis of early colorectal cancer. What's interesting is that one of their dominant nutritions is taurine. And we know that taurine is the commonest source of taurine in our diet, so these energy drinks that the youngsters seem to consume by the gallon. And there's some very interesting work coming out relating possibly that by drinking too many of these energy drinks, oversupplying the gut microflora with taurine, you get overgrowth of these potentially pro-inflammatory, pro-carcinogenic germs. So an area of intense interest. We have looked at our own genome-wide association studies, and so far we haven't come up with anything compelling genetically that allows us to identify young people who are particularly at risk of developing colorectal cancer. One could consider whether we should lower the age of inviting people into screening programs, and certainly in some nations the age of screening has been lowered to 45 for the sorts of reasons that we've talked about. But we need to think about how we influence lifestyle, how we understand better what these other contributory factors are in early life. Even in utero, what can expectant mums do to reduce those possibilities? Environmental exposures, carcinogens like smoking, alcohol and so on, are all things that one might consider. Lifestyle, diet and Western diet causing hyperinsulinemia, and again a sort of pro-carcinogenic, pro-inflammatory milieu that might cause colorectal cancer to become more incident, more prevalent in the young. So lots to consider, but a worrying trend, and one that we need to understand better, one that we need to consider how we could better intervene, but definitely the topic of intense research activity at the moment. I'd be really interested, those of you who are clinicians, have you come across increasingly young patients? Do you treat them in the same way that you would older people? What mitigation should we make in the chemotherapy regimes we use and so on? I'd be awfully interested in anything that you might have to contribute to the discussion. As always, thanks very much for listening. I'm very, very keen to hear any comments, ideas that any of our Medscapers might have. But for the time being, thanks for listening as always. Over and out.